Hi everyone, this is Dr. K. I wanted to quickly talk about herd immunity. There's a lot of controversy about COVID-19 and how herd immunity can stop it. The established belief in among Dr. Fauci and others who make the decisions is that unless we have a vaccine, we will not have herd immunity, and because of that reason, we have to continue the shutdown um, or physical distancing and all these measures for the next 1 year or so until we have a vaccine. And as you know, the problem with that is like if we can't get out and if we can't work, obviously the economy doesn't work and people can't make money and people can't earn a living. There are some who can work from job, if you're lucky to work for Facebook, Google, and other online companies, and maybe you can work from home. But a lot of us, require hands-on work, and that requires you to be out and about. And when you're out and about, you're obviously exposed to the virus. Somebody, whether it is from somebody who's sick or from someone who is asymptomatic, and they're carrying the virus. And there's a lot of research that's showing that a lot of children are asymptomatic carriers, and they can carry the virus and they can spread it to other people, and they may not show any symptoms. And this was established long back when the virus spread in China, that the kids can be carriers without having any symptoms. So there may be adults who are carriers and who may be infected, but they don't have symptoms. So we call them asymptomatic carriers, and they'll continue spreading the virus when they go out and about. There's nothing wrong with that. There's a lot of blame and shame going on. That's the natural course of any disease that is infectious. So going back to the issue of herd immunity, the common number that is touted is that people, if you have 100 people, at least 90 or 95 people have to be infected for everyone else to develop herd immunity. So herd is, like if there's a herd of sheep, it's like a group immunity instead of just one person's immunity. And herd immunity cannot happen unless you're either vaccinated or you're actually infected. So if you have 300 million people in the States, then, we have to have infections in at least 250 million or 280 million people until we get herd immunity. There are some researchers who are pointing out that this virus has been there even way back in September last year. So if it has been 8 or 9 months, then chances are, we may be reaching a situation, hi Candy, we may be reaching a situation where a lot of people are already infected and they just don't know that they're infected. And that's one reason why the states and the federal government are really pushing antibody testing, because they want to see how much herd immunity is there. It's an indirect way of looking at it. So I don't think the vaccine is an option, at least for now, at least this year. Most usually the vaccines take anywhere from 4 to 5 years to develop. So the best case scenario is looking at 1 year or 18 months. But for at least 2020, vaccine is not an option. So is that a reason to continue the way things are, where people are, wearing the mask and people can't get outside? I personally don't think so. The more, if you're healthy and if you're following the protocols, if you're following nutrition and if you're exercising, then chances are, even if you acquire the infection, your chances of death are really low. The people who are at risk are people who have comorbidities, or they're above 60 years old. They're at risk for some mortality. But even that is going down because, we are using more of treatments that are proven, at least by experience, like treatments like convalescent plasma. So we take the plasma for somebody who is already infected, harvested, and then use it in a patient who is having present infection. So a lot of my friends have noticed that that is working out really well. A lot of patients are surviving. And also there are experimental drugs. There is remdesivir, and there's immunoglobulins. There are other options to treat that, we are gaining a lot more experience, and we're gaining a lot more comfortable, like a lot of doctors are becoming more and more comfortable treating COVID now. And we're also not putting people on the breathing machines, the ventilators, right away. Um, we are using other devices like the high flow oxygen, the BiPAP, and others, and trying to buy time for them so that they don't get on the ventilator. Because if they get on the ventilator, their prognosis is poor. So that practice has changed significantly over the last several weeks. So even people who are, who are at risk and they are high risk for getting the infection, a lot of them are surviving now. So I think herd immunity is going to happen. It may not have happened yet, but in the next few months, hopefully we'll get to a situation where the general population will have herd immunity, and the spread of the virus will go down from then. So until that time, the issue remains whether they want to continue the shutdown in most of the states or whether they're going to let people move around freely. There's also controversy about wearing masks. Obviously, if you wear the mask, you have less exposure, but that delays the process of herd immunity. We want people to be exposed so that they can develop immunity to this, whatever this virus strain is. There may be multiple strains around. So there's one viewpoint, but the other viewpoint is to be safe. They want everybody to wear masks so that there's less spread of the virus. So that's going to delay things. So instead of the virus peaking in the next 2 months, it may peak in 6 months or 18 months. I'm not sure. So those are some of my thoughts about herd immunity. It's an interesting concept. And hopefully, once we have herd immunity, then they can open up everything just like it was 6 months ago. So look forward to talking to you all again. I'll come back next, like tomorrow. On the 15th, I'm offering a yoga session through Zoom at around 6 p.m. in the evening. I invite you to attend that. I'll throw in a sign-up link here over the next one day. So I would like you to sign up for that. And if you need to reach me, please send me a DM. I'm always available. Okay. Have a wonderful day. Okay. Bye.